Let's together prepare for disasters. Chapter 1, Incident Management. Introduction to the Incident Management. The most important factors are command and control. Establishing a clear chain of command is vital. Incident commander takes charge for effective decision making. Reliable communication. Reliable communication is essential for transmitting information, assigning tasks, and providing updates. Clear channel and protocol should be established. Resource management. Proper allocation of resources such as personnel, equipment, and supplies is crucial. Resource tracking and distribution must be well coordinated. Request for assistance. Promptly request assistance by contacting local, regional, or national emergency response agencies in the event of an incident. Provide detailed information on the situation, including location, incident type, and required resources for a swift response. Approaching the scene. When approaching an incident scene, first responders must plan and assess carefully, considering factors like incident nature, potential hazards, and safe access routes. Ensure proper coordination and communication with other responding agencies to prevent duplication of efforts during incident response. Types of incidents. Incidents vary. Natural disasters, example earthquakes, technology mishaps, example chemical spills, and human-made crisis, example terrorist attacks. Understanding each incident type is vital for crafting an effective response strategy. Responders must grasp the diverse nature of incident to ensure informed and targeted actions. Scene assessment. Size up. Determine the scale of incident, the number of casualties, and the extent of damage. Hazards. Identify potential risks such as fire, gas leaks, or unstable structures. Victims. Assess the number and condition of victims and categorize them based on their injuries. Scene safety. Maintaining the safety of responders and the public is a top priority. This involves establishing a perimeter, create a secure area to prevent unauthorized access and protect personnel. Hazard mitigation. Implement measures to minimize risks such as turning off utilities or stabilizing dangerous structures. Gaining access. Essential access to the scene requires responders to identify safe entry and exit points considering terrain, road conditions, and nearby hazards. Specialized equipments like rope, ladders, or heavy machineries may be necessary for secure access and support. Personal protection equipment. Proper personal protective equipment is indispensable to ensure the safety of responders. PPE may include helmets, gloves, masks, goggles, hazmat suits, and more depending on the nature of the incident. Proper training in the use and maintenance of PPE is critical. Medical equipments. Medical equipment is essential for providing initial medical care to victims. This may include first aid kits, defibrillators, stretchers, and other life-saving tools. Responders should be trained to use these tools effectively, especially in high-stress situations. Let's conclude. Disaster training and incident management are fundamental components of preparedness and response. The ability to coordinate resources, assess scenes, ensure safety, and provide assistance is crucial for mitigating the impact of emergencies and disasters. By understanding these core elements and maintaining rigorous training, responders can better protect lives and property when the unexpected occurs. Basic life support, foreign body airway obstruction, and cardiopulmonary resuscitation. Let's learn the techniques related to the basic life support. Technique for opening the airway. Maintaining an open and clear airway is critical when responding to emergencies. The head tilt chin lift maneuver is a commonly used technique to open the airway. It involves gently tilting the victim's head backwards while lifting their chin. This maneuver helps prevent airway obstructions and ensures a clear passage for airflow. Rescue breathing. In situations where a victim's breathing is absent or inadequate, rescue breathing is crucial. It involves delivering breaths to the victim to provide them with the necessary oxygen. The ratio of chest compressions to rescue breaths varies, but is often 30:2 in adult CPR. For infant and children, it may differ. Proper training ensures that responders can provide effective rescue breathing without causing harm. Obstructed airway. Foreign body airway obstruction occurs when an object becomes lodged in the victim's airway, obstructing their ability to breathe. Recognizing the signs of FBAO such as choking, gasping, or an inability to speak is essential. Responders should be trained in techniques to dislodge the obstruction, such as the Heimlich maneuver for conscious victims or back blows and chest thrusts for infants and unconscious victims. Steps for clearing or opening an airway. Check for responsiveness. First, assess the victim's level of consciousness by tapping and shouting for a response. Call for help. If the victim is unresponsive, call for emergency assistance immediately. Open the airway. Use the head tilt, chin lift technique to open the airway. Check for breathing. Assess if the victim is breathing normally. If not, provide rescue breathing. Anatomy of the circulatory system. The circulatory system comprises the heart, blood vessels, and blood. It functions to transport the oxygen, nutrients, and waste products throughout the body. A disruption in the circulatory system, such as cardiac arrest, necessitates CPR, cardiopulmonary resuscitation. Steps for CPR. Check for responsiveness. As with opening the airway, assess the victim's level of consciousness. Call for help. If the victim is unresponsive, call for emergency assistance. Begin the CPR. Perform the chest compressions and rescue breaths in accordance with the recommended ratio, that is 30/2 for adults. Complications of inadequate CPR. Inadequate or poorly performed CPR can lead to various complications, including brain damage or death. Proper training and continuous practice are crucial for ensuring the effectiveness of CPR and minimizing complications. Initiating and terminating CPR. CPR should be initiated as soon as possible when responding to a victim with no pulse or ineffective breathing. It should only be terminated under certain circumstances, such as when professional medical help arrives, the victim revives, or when the responder is physically unable to continue. Continuous reassessment and adherence to protocols are vital. Let's conclude. Disaster training encompassing basic life support, foreign body airway obstruction, and cardiopulmonary resuscitation is a vital component of preparedness for emergencies and disaster. These life-saving techniques are essential for responders to effectively address medical crises and sustain life until professional medical help arrives. Proper understanding of the respiratory and circulatory system, along with rigorous training, ensures that responders can take swift and decisive actions in critical situations, potentially saving lives and minimizing the impact of disaster. The Emergency Medical Services System. Disaster training plays a pivotal role in ensuring a coordinated and effective response during emergencies. One crucial aspect of disaster response is understanding the emergency medical services system, which is the backbone of pre-hospital medical care. In this article, we will explore the components of EMS system, the importance of first aid, pre-hospital treatment, the duties of the first aider, essential qualities of a first aider, and the legal considerations associated with providing medical assistance during a disaster. Components of the EMS system and first aid. The EMS system is a network of trained professionals, equipments, and facilities designed to provide prompt medical care to those in need, especially during critical situations such as accidents, illness, or disaster. It comprises several key components including dispatch centers. These centers receive emergency calls and coordinate the response of EMS personnel and resources. First responders. They are typically trained individuals such as police officers and firefighters who arrive first at the scene of an emergency to provide initial care. Emergency medical technicians. EMTs are trained to provide basic medical care and transportation of patients to healthcare facilities. Paramedics. Paramedics are highly trained individuals capable of administering advanced life support such as administering medications and performing invasive procedures. First aid. First aid is a crucial element of the EMS system, and it involves the immediate temporary care provided to someone who is injured or ill. First aid aims to prevent further harm, alleviate pain, and stabilize the condition of the victim until professional medical assistance can be sought. It includes action like controlling bleeding, immobilizing fractures, and administering CPR. Pre-hospital treatment. Pre-hospital treatment is a care provided by EMS personnel before a patient reaches a hospital or healthcare facility. This treatment can be life-saving as it addresses critical issues and stabilizes the patient's conditions. Pre-hospital care includes administering medicines, performing advanced life support procedures, and managing trauma cases. Duties of the first aider. First aider plays a vital role in disaster response by providing immediate care to those in need. Their duties include assessment, evaluating the victim's conditions to determine the severity of the injury or illness. Communication, contacting emergency services and providing essential information about the situation. First aid, administering appropriate first aid techniques to stabilize the victim's conditions, such as CPR, bandaging, and immobilization. Comfort and reassurance, offering emotional support to the victim to alleviate fear and anxiety. Qualities of the first aider. Being an effective first aider requires specific qualities and skills such as calmness, maintain composure and staying calm under pressure. Empathy, showing compassion and understanding towards the victim's suffering. Adaptability, being able to assess and respond to various situations, adapting techniques such as which are necessary. Clear communication, effectively conveying information to both the victim and medical professionals. Legal issues, providing first aid comes with legal consideration. Good Samaritan laws in many jurisdictions protect those who offer assistance in good faith during emergencies. These laws typically shield first aiders from liabilities as long as they act reasonably and within their training. However, it's essential to understand local laws and regulations regarding first aid to ensure compliance. Let's conclude. Disaster training is incomplete without a thorough understanding of emergency medical services system, the significance of first aid, and the associated legal consideration. First aiders play a crucial role in providing immediate care and support during disaster, potentially saving lives and minimizing the impacts of emergencies. With the right training, qualities, and knowledge of legal obligations, first aiders can make a significant difference in ensuring the well-being of victims and supporting the overall disaster response efforts. Material safety data sheet. Identification of hazardous material, safety and evacuation plan, personal protective equipment, guidance, decontamination protocols, response coordination and resource allocation, risk communication, training and preparedness. Identification of hazardous materials. One of the primary functions of MSDS is to identify hazardous material and their properties. In the context of disaster management, this information is critical for assessing the potential risk associated with chemicals that may be present in the disaster-affected areas. This identification allows for informed decision-making when responding to the emergencies such as natural disaster, industrial accidents, or hazardous material spill. Safety and evacuation planning. MSDS contains detailed information on the safe handling, storage, and disposal of chemicals. During a disaster when hazardous materials may be compromised, these documents can guide emergency responders and local authorities in developing safety and evacuation plans. Understanding the proper procedures for contaminant neutralization or disposal of hazardous material can prevent further harm to the environment and human health. Personal protective equipment guidance. MSDS include recommendations for the usage of personal protective equipment when handling chemicals. In disaster management, this guidance is invaluable for emergency responders, ensuring they have the appropriate gear to protect themselves while mitigating chemical-related risk. Knowing what types of PPE are necessary helps reduce injuries and health risk among responders. Decontamination protocols. Disaster can result in contamination with hazardous substances, whether through chemical spills, fires, or other events. MSDS provide decontamination guidance, which is essential for both affected individuals and emergency responders. Proper decontamination procedures can significantly reduce the spread of hazardous materials and the associated health risks. Response coordination and resource allocation. By having access to MSDS, emergency management teams can effectively allocate resources based on the specific hazard involved in a disaster. This targeted approach ensures that responders have the necessary equipment and expertise to address the unique challenges posed by the chemical incident, thereby enhancing response efficiencies. Risk communication. During a disaster, clear communication is essential. MSDS offer standardized information that can be effectively shared with the public, healthcare professional, and relevant authorities. This aids in raising awareness about chemical hazards, ensuring a more coordinated and informed response. Training and preparedness. MSDS serves as valuable training materials for first responders and emergency management teams. Pre-disaster training can familiarize responders with the properties and risks associated with various chemicals, enabling them to make informed decisions in the field. By promoting preparedness, MSDS contribute to a more effective and proactive approach to disaster management. Let's conclude. MSDS are not only essential for workplace safety but also play a critical role in disaster management. These documents provide vital information for identifying hazardous materials, developing safety plans, and ensuring the well-being of both responders and the affected population. By incorporating MSDS into disaster response and preparedness strategies, emergency management teams can significantly enhance their ability to manage chemical-related risk and protect the community in the times of crisis. Immediate measures for disease prevention. In disaster management, one of the most critical aspects is ensuring the prevention of diseases that can easily spread in chaotic and unsanitary conditions. This article will discuss the immediate measures of disease prevention, focusing on modes of transmission, recognizing signs and symptoms, pre-hospital treatment, and the application of universal precautions during disaster situation. Modes of disease transmission. Understanding how diseases are transmitted is fundamental in disaster management. Common modes of transmission include direct contact. Disease can be spread through physical contact with infected individuals, contaminated surfaces, or bodily fluids. Proper hand hygiene and proper protective equipment are essential to reduce this risk. Airborne transmission. Some diseases such as respiratory infections are transmitted through tiny respiratory droplets that remain suspended in the air. Proper ventilation and respiratory hygiene can minimize the risk of airborne transmission. Vector-borne transmission. Certain diseases are spread through the bite of infected vectors like mosquitoes or ticks. Implementing vector control measures such as insect repellents and environmental management is crucial. Water and foodborne transmission. Contaminated water or food can lead to the transmission of various diseases. Proper water treatment, sanitation, and food safety measures are essential. Signs and symptoms. Recognizing the signs and symptoms of disease in disaster-affected areas is vital for early detection and treatment. Common symptoms may include fever, diarrhea, vomiting, skin rashes, respiratory distress, and more. Proper training can help responders and healthcare providers identify potential disease outbreaks, enabling timely intervention. Pre-hospital treatment. In disaster management, immediate pre-hospital treatment can make a significant difference in preventing the spread of diseases. This includes isolation, separating infected individuals from the general population to prevent the spread of disease. Quarantine, restricting the movement of individuals who may have been exposed to an infectious agent but are not yet symptomatic. This helps contain potential outbreaks. Provision of basic care. Administering first aid, rehydration therapy, and other essential treatments to those affected by injuries or illness. Safe burial practices. Proper management of deceased individuals to prevent disease transmission. Universal precautions. Universal precautions are a set of infection control practices designed to protect both healthcare workers and the public. In disaster management, these precautions are essential. They include hand hygiene, regular and thorough hand washing with soap and water, or using hand sanitizers to reduce the risk of disease transmission. Personal protective equipment. Proper use of PPE, including gloves, masks, gowns, and eye protection when coming into contact with potentially infectious material. Environmental sanitation. Keeping the environment clean and disinfected to minimize disease transmission. Respiratory hygiene. Encouraging individuals to cover their mouth and nose when coughing or sneezing, and proper disposal of used tissues. Let's conclude. Immediate measures of disease prevention are integral to effective disaster management. By understanding modes of transmission, recognizing signs and symptoms, providing pre-hospital treatment, and adhering to universal precautions, disaster responders and healthcare providers can help contain disease outbreaks and reduce the risk of infections in disaster-affected areas. Proper training, preparation, and coordinated efforts are essential to safeguard public health during and after disasters. Anatomical references. Initial physical assessment and examination. Anatomical position. The anatomical position is a standard reference point used in medical practice. It involves the following key features. Standing upright. The body stands erect, facing forward with arms at the sides and palms forward. Feet together. The feet are parallel with toes pointing forward. Reference points or landmark points on the body provide a standardized way to describe the locations of anatomical structures. Common reference point includes the sternal notch, umbilicus, and anterior superior iliac spine. These reference points aid healthcare professionals in precise communication during patient assessment and care. Divisions. Understanding the body's divisions and cavities is essential for a systematic and comprehensive examination of disaster victims. Body divisions. The body is divided into axial and appendicular divisions. The axial division includes the head, neck, and trunk, while the appendicular division comprises the limbs. Body cavities. The human body contains several cavities such as the cranial cavity, housing the brain, thoracic cavity containing the heart and lungs, abdominal cavity containing the organs of digestion, and pelvic cavity housing reproductive and excretory organs. Knowledge of these cavities is crucial for assessing and treating injuries during disaster response. Primary survey, casualty management, and 6 phases of patient assessment plan. The primary survey is a systematic approach to casualty management, focusing on the immediate assessment and stabilization of disaster victims. It consists of the following steps. Scene safety. Ensure the safety of the scene for both responders and victims. Identify any immediate hazards such as fire, chemical, or structural damage. Response assessment. Determine the victim's level of consciousness and responsiveness. Establish airway breathing and circulation by checking for signs of life and breathing. Airway maintenance. If the victim's airway is obstructed, take immediate step to clear it and ensure that the airway is patent. Breathing assessment. Assess the victim's breathing and provide artificial ventilation if needed. Administer oxygen when available. Circulatory assessment. Check the victim's pulse and control life-threatening bleeding. Initiate cardiopulmonary resuscitation if necessary. Disability assessment. Evaluate neurological status and check for any deficits or injuries such as head injuries or spinal trauma. 6 phases of patient assessment plan. A comprehensive patient assessment plan includes 6 phases. Scene size up. Assess the situation and determine safety. Identify the number of victims and available resources. Primary survey. Follow the primary survey steps to identify life-threatening conditions and initiate immediate care. History taking. Obtain the victim's history, including allergies, medications, past medical history, and the events leading to the injury or illness. Secondary survey. Perform a head-to-toe examination to identify additional injuries or medical conditions. This includes a thorough inspection, palpitation, and auscultation. Vital signs and monitoring. Continuously monitor vital signs such as pulse, blood pressure, respiratory rate, and temperature. Ongoing assessment. Reassess the victim's conditions regularly, particularly during transport or overtime, to identify any changes or deterioration. Let's conclude. Disaster management requires a well-structured approach to casualty assessment and care. Understanding the anatomical position, reference points, body divisions, and body cavities is essential for a systematic examination. The primary survey focuses on immediate life-saving interventions, while the 6 phases of a patient assessment plan ensures a thorough and ongoing evaluation of disaster victims. Proper training and adherence to these principles can significantly enhance the quality of care provided during disaster response and recovery efforts. Multiple casualty incident and triage. In the context of disaster management, dealing with multiple casualties can be a complex and challenging task. Triage, the process of assessing and prioritizing victims based on the severity of their injuries, play a crucial role in ensuring that limited resources are allocated efficiently to save the most lives. This content discusses the concept of multiple casualty incidents, the triage process, including color coding, and the importance of reviewing diagnostic signs during such crises. Multiple casualty incidents. MCIs occur when the number of casualties exceed the available resources, including medical personnel, equipment, and facilities. Natural disaster, mass accidents, and other catastrophic events often result in MCIs. Managing these incidents require a systematic approach to prioritize care for the most critically injured victims. Triage and color coding. Triage is the process of rapidly assessing and categorizing casualties to determine the order in which they receive medical attention. Color coding is a common system used to categorize victims based on the severity of their injuries. The most widely used color coding system includes the 4 categories. Immediate, red. Victims with life-threatening injuries that require immediate attention, such as severe bleeding, difficulty breathing, or uncontrolled shock. These patients should receive prompt medical care and transport. Delayed, yellow. Victims with significant injuries that are not immediately life-threatening, they require care, but it can be delayed to tend to immediate patients first. Minor, green. Victims with minor injuries or non-urgent medical needs. These individuals can wait for treatment until all immediate and delayed patients have been addressed. Triage and color coding. Expectants, black or gray. Victims with injuries are so severe that they are unlikely to survive even with medical intervention. In such cases, medical resources should be redirected to those with a better chance of survival. Review of diagnostic signs. Triage is not solely based on color coding. It also involves a quick assessment of diagnostic signs. These signs may include respiratory rate. Rapid shallow breathing or severe difficulty breathing may indicate a need for immediate attention. Pulse. A weak or absent pulse may signal critical injury, while a strong pulse may indicate a less severe condition. Mental status. Altered mental status such as confusion or unconsciousness can be a sign of life-threatening injuries. Capillary refill. Slow capillary refill can suggest poor circulation and a need for urgent care. Bleeding. Uncontrolled bleeding requires immediate attention to prevent further blood loss. Airway obstruction. Victims with a compromised airway need immediate assistance to maintain oxygenation. Burns. Severe burns or burns in sensitive areas like the face or airway need prompt attention. Let's conclude. Triage in multiple casualty incidents is a critical component of disaster management. By using color coding and diagnostic signs, responders can efficiently allocate resources to those who need them most urgently. It is essential to train emergency personnel in effective triage techniques to ensure a rapid and coordinated response that maximizes the chances of survival for disaster victims. Proper and consistent use of these systems can save lives and optimize the utilization of available resources during crisis. Hemorrhage and shock. Disaster management encompasses a wide range of skill and knowledge, including the ability to address medical emergencies such as hemorrhage and shock. Understanding the circulatory system, pulse, location, blood composition, perfusion, and the various types of shock is vital for first responders during crisis. In this article, we will provide an overview of these topics and their relevance in disaster management, with a particular focus on anaphylactic shock and both internal and external hemorrhage. Circulatory system and blood. The circulatory system comprises the heart, blood vessels, and blood. It is essential for distributing oxygen and nutrients throughout the body while removing waste products. The heart pumps oxygenated blood to tissues and veins return deoxygenated blood to the heart. Blood is a vital fluid that carries oxygen, nutrients, hormones, and immune cells, while also play a crucial role in maintaining hemostasis. Pulse locations. Pulse locations are vital for assessing the circulatory system's functions. Common pulse locations include the carotid artery, neck, radial artery, wrist, brachial artery, inner elbow, femoral artery, groin, popliteal artery behind the knee, dorsal pedis artery, top of the foot, and posterior tibial artery, ankle. Blood and blood volume. Blood is primarily composed of plasma, red blood cells, white blood cells, and platelets. Plasma is the liquid component that carries blood cells and proteins. Blood volume is an essential factor in maintaining adequate circulation, and severe hemorrhages can lead to shock. In disaster management, understanding blood loss and monitoring blood volume is critical to preventing shocks in victims. Perfusion shock. Perfusion refers to the flow of blood through the body's tissue and organs, providing oxygen and nutrition. When perfusion is compromised, shock can occur. Shock is a life-threatening condition where the body's vital organs and tissues do not receive enough oxygen and nutrients. Common types of shock include hypovolemic shock. This occurs due to a significant loss of blood or plasma, typically from hemorrhage. It results in decreased blood volume and inadequate perfusion. Cardiogenic shock. Caused by heart failure, this type of shock results from the heart's inability to pump sufficient blood to meet the body's needs. Distributive shock. Anaphylactic shock, a form of distributive shock, is triggered by a severe allergic reaction causing vasodilation and a drop in blood pressure. Anaphylactic shock. Anaphylactic shock is a severe and rapid onset allergic reaction that can lead to life-threatening symptoms, including difficulty breathing, swelling, and a drop in blood pressure. Timely administration of epinephrine and rapid medical intervention is crucial to preventing fatalities. Internal and external hemorrhage. Hemorrhage is the loss of blood from blood vessels. It can be internal or external. External hemorrhage. This type is visible and occurs when blood exits the body through wounds or open injuries. First responders should promptly control external bleeding by applying direct pressure, using tonics, or packing wounds with dressing. Internal hemorrhage. Internal bleeding may not be immediately visible, but it can be life-threatening. Signs may include pain, swelling, and a drop in blood pressure. Prompt medical evaluation is necessary to address internal hemorrhage. Let's conclude. Disaster management requires a solid understanding of the circulatory system, blood components, and the critical relationship between hemorrhage and shock. Responders must be trained to recognize the signs of shock, administer appropriate treatments, and manage hemorrhage effectively. By doing so, they can help save lives and minimize the impact of medical emergencies during crisis. Injuries to the skull, spine, and chest. Disaster management encompasses a broad range of knowledge and skills, including the ability to respond effectively to various types of injuries. In this article, we will focus on injuries to the skull, spine, and chest, discussing specific type of injuries and the essential pre-hospital treatments required to provide the best care to victims during the disaster situation. In disaster scenarios, injuries to the skull can be caused by various factors, including falls, flying debris, or blunt trauma. Specific injuries to the skull include head contusions and lacerations. These injuries involve damage to the scalp, often leading to bleeding. Control bleeding by applying direct pressure to the wound with a sterile dressing. Skull fractures. A fractured skull can be life-threatening as it results in brain injury and intracranial bleeding. Pre-hospital care involves immobilizing the head and neck to prevent movement, maintaining an open airway, and stabilizing the head to minimize further damage. A concussion is a mild traumatic brain injury. Victims should be monitored for signs of worsening conditions such as altered mental status or vomiting. Spinal injuries can result from accident, falls, or direct trauma. Specific spinal injuries include spinal fractures. A fracture in the spine can damage the spinal cord and lead to paralysis. Immobilization of head and neck and careful handling of victims are essential to prevent further harm. Spinal cord injuries. Injuries to the spinal cord can result in loss of motor or sensory functions. Victims with suspected spinal cord injuries should not be moved unless there is a threat to their life. Immobilize the head and neck and stabilize the spine. Chest injuries are common in disaster situations, often resulting from impacts, falls, or accidents. Specific injuries to the chest include rib fractures. Fractured rib can cause severe pain and impair breathing. Pre-hospital treatment involves providing pain relief and stabilizing the chest. Pneumothorax. A pneumothorax occurs when air enters the space between the lung and the chest wall, causing the lung to collapse partially. Pre-hospital care includes providing oxygen and ensuring prompt medical evaluation. Flail chest. This injury occurs when a segment of the rib cage becomes detached from the rest of the chest wall. It can lead to difficulty breathing and respiratory distress. Stabilize the flail segment with a bulky dressing or bandage. Pre-hospital treatment. Providing effective pre-hospital treatment for these injuries is crucial in disaster management. Scene safety. Ensure the safety of both responders and victims before administering care. Assessment. Conduct a thorough assessment to identify and prioritize injuries. Immobilization. For head and spine injuries, immobilize the head and neck to prevent movement. For chest injuries, immobilize the chest or any injured segment. Pain management. Provide pain relief as needed to reduce the suffering of victims. Stabilization. Stabilize injuries to prevent further damage, such as securing fractures, ribs, or flail chest segments. Monitoring. Continuously monitor the victim's condition and provide reassurance and comfort. Let's conclude. Disaster management involves being prepared to address a wide range of injuries, including those to the skull, spine, and chest. By recognizing the specific injuries, taking appropriate pre-hospital actions, and ensuring the safety of victims and responders, disaster response teams can play a critical role in minimizing the impact of injuries during crisis and providing the best possible cares to victims. Lifting and moving patients. In disaster management, responders frequently encounter situations where lifting and moving patients are essential. Proper techniques for lifting and moving patients are crucial for the safety of both the patient and the responder. This content outlines the method for correct lifting, maintaining correct posture, and handling patients with neck and spinal injuries during the disaster response. Methods for correct lifting. The power lift. The power lift is one of the safest methods for lifting the patients. It involves bending at the knees while keeping the back straight and the patient close to the body. Hold the patient's weight close to your center of gravity and use your leg muscles to lift. The squat lift. Similar to the power lift, the squat lift involves bending at the knees, keeping the back straight, and using leg muscles for lifting. The squat lift is particularly useful when working in confined spaces. The dragging technique. For patients who are unable to assist in their movement, the dragging technique is an effective method. It involves gripping the patient's clothing or a blanket and dragging them to safety. However, avoid using this method with patients who have suspected spinal injuries. Correct posture. Maintaining correct posture is essential for minimizing the risk of injury to both the responder and the patient. Back straight. Keep the back straight at all the times when lifting or moving a patient. Avoid bending at the waist, which can strain the lower back. Knees bend. Bend at the knees, not the waist, to lower your body to the patient's level. This engages the legs muscle, which are stronger and less prone to injury. Center of gravity. Keep the patient close to your center of gravity to maintain balance and control with lifting or moving. Stable footing. Ensure your footing is secure before lifting. Slips or trips can result in injuries to both you and the patient. Handling neck and spinal injuries. Patients with suspected neck or spinal injuries require special care during lifting and moving. Any sudden movements or improper handling can worsen these injuries. Here are specific guidelines for handling such cases. Stabilization. First, ensure that the patient's neck and spine are adequately stabilized. This may involve using cervical collars, backboards, or improvised supports like rolled up blankets. Log roll technique. When moving a patient with a suspected neck or spinal injury, use the log roll technique. Maintain the patient's head, neck, and spine in a straight line and gently roll them to the desired position. Multiple responders should coordinate to ensure smooth and controlled movement. Minimal movement. Limit movement as much as possible, only performing essential maneuvers for patient's care. Avoid bending, twisting, or lifting the patient unnecessarily. Secure the head. Always secure the patient's head to prevent it from moving during transfers. Use one hand to maintain inline immobilization of the head and neck. Spinal immobilization. Ensure the patient remains immobilized or a backboard or other appropriate spinal support until they can receive a thorough medical evaluation. Let's conclude. Proper lifting and moving techniques are indispensable skills for disaster responders. They not only protect the well-being of the patients but also prevent injuries to the responders themselves. Maintaining correct posture, using appropriate lifting methods, and being cautious when handling the patients with neck or spinal injuries are fundamental practices in disaster management. Well-trained responders who can execute these tasks safely and effectively play a vital role in ensuring the well-being of disaster victims. Mechanisms of injury. Disaster management requires a comprehensive understanding of the mechanisms of injury that individuals may face during a crisis. It's crucial to be knowledgeable about the potential injuries that can result from various mechanisms and to be prepared to address specific medical conditions that may arise in the aftermath of a disaster. This article explores the mechanism of injury, potential injuries, and key syndromes associated with disaster management, with a particular focus on crush syndrome, compartment syndrome, and the importance of immobilization. Mechanisms of injury. Blunt force. Injuries caused by direct impact or collision, often resulting in contusions, fractures, or internal injuries. Penetrating injuries occurs when objects such as projectile or debris pierce the body, potentially leading to wounds, punctures, or damage to the internal organs. Blast injuries. Common in explosions, blast injuries can result in a combination of blunt, penetrating, and thermal injuries, as well as barotrauma and eardrum ruptures. Crushing injuries occurs when the body is subjected to prolonged pressure or compression, often leading to severe soft tissue and bone injuries. Thermal injuries result from exposure to extreme temperatures, causing burns, scalds, or frostbite depending on the circumstances. Chemical and biological exposure can lead to various injuries, including chemical burns, respiratory issues, and infections. Potential injuries. Fractures. Bone fractures are common in disaster situations, often requiring immobilization and support to prevent further damage. Burns. Burns can vary in severity from mild to life-threatening and require immediate and appropriate care. Lacerations. Open wounds can result in significant blood loss and infection if not treated promptly. Soft tissue injuries. Damage to muscles, tendons, and ligaments can impair mobility and may require surgical intervention. Traumatic brain injuries. Blunt force trauma to the head can lead to concussions, intracranial bleeding, or severe brain injuries. Crush syndrome. Crush injuries can result in crush syndrome, which occurs when released toxins overwhelm the body, potentially leading to kidney failure and shock. Compartment syndrome occurs when swelling in a muscle compartment leads to increased pressure, which can impede blood flow and result in tissue damage. Crush syndrome and compartment syndrome. Crush syndrome injuries can cause muscle damage, releasing myoglobin into the bloodstream. If not adequately flushed from the body, myoglobin can lead to kidney damage and failure. Treatment involves aggressive fluid resuscitation and monitoring for renal complications. Compartment syndrome. This condition occurs when increased pressure with a muscle compartment causes impaired blood flow. Symptoms include pain, numbness, or tingling. Early detection is crucial and treatment may involve surgical intervention to release pressure within the compartment. Immobilization. Immobilization is a critical aspect of managing injuries, especially fractures or suspected spinal injuries. Proper immobilization techniques help prevent further damage and reduce pain. Tools such as splints, slings, and backboards can be employed to ensure the patient remains stable during transportation to a healthcare facility. Let's conclude. Disaster management involves understanding the mechanism of injury and their potential consequences. As a result, as well as being prepared to address specific medical conditions that may arise. Crush syndrome and compartment syndrome are just two examples of the complications that can occur following injuries in disaster situation. A well-trained disaster response team must be equipped to identify and treat these conditions while also practicing proper immobilization techniques to ensure the safety and well-being of the disaster victims. Soft tissue injuries. Soft tissue injuries are common in disaster scenarios resulting from accident, falls, or various forms of trauma. Proper management of these injuries is crucial to prevent infection, control bleeding, and promote healing. This article dwells into the use of dressing and bandage for both open and closed soft tissue injuries and outlines essential pre-hospital treatments that disaster responders should be well versed in. Dressing and bandages. Dressings are sterile or clean coverings placed directly on wounds. They serve several purposes including controlling bleeding by applying direct pressure, protecting the wound from contamination, promoting a moist environment for optimal wound healing. Bandages are used to secure dressing in place and provide support to the injured area. There are various types of bandages including roller bandage, typically used for securing dressing, stabilizing splints, and providing support to joints. Triangular bandages useful for creating slings, immobilizing injuries, and securing dressings. Elastic bandages ideal for compressing and supporting injuries areas like sprained ankles or swollen limbs. Open soft tissue injuries. These injuries involve a break in the skin, creating an entry point for pathogens and a risk of infection. Common examples include lacerations, punctured wound, and abrasions. Pre-hospital treatment for open injuries. The key steps include controlling bleeding. Apply direct pressure with a sterile dressing to stop the bleeding. Cleaning the wound. Gently cleanse the wound to remove debris and lower the risk of infection. Dressing and bandaging. Cover the wound with a sterile dressing and secure it with a bandage. Ensure that the dressing is non-adherent to avoid disrupting the wound during dressing changes. Closed soft tissue injuries. These injuries occur without breaking the skin, but they can lead to significant internal damage and bleeding. Common examples include contusions and hematomas. Pre-hospital treatment. For closed injuries, responders should focus on pain relief and immobilization to prevent further harm. Monitor for signs of compartment syndrome, which can occur in some closed injuries and requires immediate intervention. Pre-hospital treatment, primary survey. In disaster management, the primary survey remains the initial assessment of a patient's condition, ensuring that life-threatening injuries are addressed first. If there are immediate threats to life such as uncontrolled bleeding, these must be controlled immediately. Secondary survey. After addressing immediate threats, responders should conduct a thorough secondary survey to assess and manage other injuries, including soft tissue injuries. This includes cleaning and dressing wounds, immobilizing fractures, and providing pain relief as needed. Infection control. Preventing infection is vital. Ensure that all dressing and bandages are sterile or clean and monitor wounds for signs of infection during follow-up care. Documentation. Accurate and comprehensive documentation is essential for patient care continuity. Record injury assessment, treatments provided, and any changes in the patient's condition. Let's conclude. Soft tissue injuries are a common concern in disaster management, requiring appropriate dressing and bandaging to promote healing and prevent infection. Whether dealing with open or closed injuries, disaster responders must be well prepared to provide pre-hospital treatment, including controlling bleeding, cleaning wounds, and using sterile dressings and bandages. By following established protocols and maintaining infection control, responders play a critical role in ensuring the well-being of disaster victims and minimizing complications in the aftermath of the crisis. Musculoskeletal injuries. In disaster management, dealing with musculoskeletal injuries is a common occurrence as individuals may suffer fractures, sprains, strains, and other skeletal system related injuries during crisis. Understanding how to assess and immobilize these injuries is crucial for disaster responders. This article will explore the skeletal system, the management of fractures, sprains, and strains, reasons for immobilization, techniques for immobilization, and the use of manual traction in disaster scenarios. Skeletal system. The skeletal system is a framework of body, providing structure and support while protecting vital organs. It's made up of bones, joints, cartilage, and ligaments. In disaster situations, the skeletal system can be vulnerable to various injuries. Fractures. A fracture is a break or a crack in a bone. It can be a complete break or partial break. Fractures can be open or closed. Pre-hospital treatment. Managing fractures in disaster situation is critical. Immediate steps include immobilization. Immobilize the injured limb or area to prevent further damage and alleviate pain. This is typically done using splints, bandages, or any available material like boards or clothing. Control bleeding. If an open fracture is present, control bleeding by applying pressure with a sterile dressing or bandage. Sprains and strains. Sprains involve the stretching or tearing of ligament which connect bone to bone. Common affected areas include the ankles and wrist. Strains involve the stretching or tearing of muscles or tendons. Common areas of strains include the back and the hamstring muscles. Pre-hospital treatment. Pre-hospital care for sprains and strains entails rest. Encourage the victim to rest and avoid putting weight on the injured area. Ice. Applying ice to the injured area can help reduce swelling. Compression. Use bandages or wraps to compress the injured area and limit swelling. Elevation. Elevating the injured limb can also help reduce swelling. Reasons for immobilization. Immobilization serves several purposes in disaster management. It prevents further injury. Immobilization prevents the movement of fractured bones or injured joints, reducing the risk of causing additional harm. Pain relief. Immobilization often alleviates pain and discomfort in individual musculoskeletal injuries. It reduces swelling. By minimizing movement, immobilization can help reduce swelling in the injured areas. The techniques for immobilization. Splints. Splints are rigid material that provide support and immobilization. They can be custom made from material like cardboard, wood, or aluminum, or improvised using available resources like branches or clothing. Bandages and wraps. Elastic bandages and wraps can be used to secure splints and compress the injured area, reducing swelling. Manual traction. Manual traction is a technique used to align and immobilize a fractured or dislocated joint, typically in the limbs. Disaster responders should exercise caution and use gentle, controlled traction to prevent further damage. Let's conclude. In disaster management, the ability to assess and manage musculoskeletal injuries is vital for ensuring the well-being of victims. Understanding the skeletal system, recognizing fractures, sprains, and strains, and knowing when and how to immobilize injuries are essential skills. Disaster responders must be well prepared to provide immediate care, which can help prevent further damage, reduce pain, and promote the recovery of those affected by musculoskeletal injuries during crisis. Behavioral skills and personal development. Disaster management is not only about physical responses and medical procedures. It also involves a set of critical behavioral skills and personal development strategies. Effective communication, motivational skills, stress management, and health management play a pivotal role in enhancing disaster response efforts. This content dwells into the importance of these skills and practice for disaster responders. Communication skills. Clear communication. Effective communication is a cornerstone of disaster management. Responders must be able to convey information clearly and succinctly to team members, other agencies, and disaster victims. Miscommunication can lead to confusion and inefficiency. Active listening. Listening actively and attentively to others' concern and need is essential for understanding and addressing the unique challenges presented during disaster. It also builds trust and rapport with those affected. Crisis communication. Responders must be prepared to deliver difficult or distressing information with sensitivity and empathy. Compassionate communication is critical when dealing with traumatized individuals. Motivational skills. Motivating self and others. Self-motivation. Disaster responders often work under challenging conditions, and self-motivation is essential to remain focused and effective. Maintaining a sense of purpose and resilience in the face of adversity is vital. Team motivation. Leaders with disaster response teams must motivate and inspire their team members. Recognizing and acknowledging efforts, setting clear goals, and fostering a positive team environment can boost morale. Motivating victims. Motivating disaster victims to follow safety protocols, make decisions, and adapt to rapidly changing circumstances can save lives. Encouraging hope, providing support, and offering practical assistance are valuable motivational skills. Stress management, self-care. Disaster responders are exposed to high-stress situations, and self-care is crucial. They must prioritize rest, nutrition, and hydration to maintain physical and mental well-being. Mental health support. Recognizing the signs of stress, anxiety, and trauma in oneself and others is essential. Responders should be encouraged to seek professional support when needed and to access available mental health resources. Debriefing. Post-disaster debriefing session can help responders process their experiences and emotions. Sharing thoughts and feelings with colleagues in a supportive environment is a valuable stress management tool. Health management. Hygiene practices. Maintaining proper hygiene practices is critical to prevent the spread of disease in the disaster-affected areas. Responders must follow rigorous hygiene protocols to protect both themselves and the community. Infection control. Disaster responders should be well informed about infection control measures, including the proper use of personal protective equipment and following established procedures to minimize the risk of infection. Vaccination. Being up to date with vaccination can protect responders and prevent the spread of vaccine-preventable diseases in disaster-stricken areas. Let's conclude. Behavioral skills, personal development, and health management are integral components of effective disaster management. Clear and empathetic communication, motivational skills, and stress management are essential for maintaining a resilient and effective disaster response team. Additionally, adhering to strict health and hygiene practices is vital to protect both responders and the communities they serve. By focusing on these aspects, disaster responders can enhance their overall effectiveness and contribute significantly to the disaster relief efforts.